Hey guys, so today we have Dan, who is a pro CrossFitter, and what he's been doing is a lot of shrugs and training for heavier snatches and clean and jerks. What he's found is he's increased his volume. He's getting a lot of tension up into the neck. And one of the big things is he's finding like a pinchy jammy sort of sensation when he's turning his head to the right and extending as well. So one of the tests I did here with him was, it's called Kemp's, where we close down the facet joint there. And Dan was saying that that feels quite tight and pinchy, and it's sort of radiating pain into this region. And as a result, he's got a lot of sort of muscle spasm and whatnot through that area and having trouble just turning day to day, stuff like that. So what we're going to do today is we're going to sort of rip into Dan's muscles around the neck here with some active release technique, as well as dry needling and giving some joint manipulation to open up that facet joint and let that settle down. So to start with, Dan, we might actually get you laying down on your back. And we'll start by getting into those scalenes because it'll just allow a bit more range through that rotation and lateral flexion. Lily, I'll get you come around this side. So here, scalene sort of comes up the side of the neck, and it's sort of involved, with lifting the arm and shrugging. Also an accessory muscle with sort of when you're really exhausted, you have to take sort of more forced breathing, which would be, when you're gassed in a CrossFit workout or something like that. Other issues you can get with this muscle is your brachial plexus, all those nerves that come out of the neck, they'll pass under this. So that's going to cause a lot of issues around here, which if it gets really bad will sort of refer down into the arm as well. How's that feeling, Dan?
Yeah,
pretty rubbish?
Yeah.
Yeah. So the next muscle I want to work on is the sternocleidomastoid muscle, which sort of comes from the SC joint, the end of the clavicle here, up towards the ear. And that's going to sort of pull the head forward, and it'll spasm up in a lot of neck sort of injuries. It's a big one for sort of creating headaches and things too, which luckily Dan hasn't got yet. We'll just catch this muscle early before it sort of gives him any dramas. Now obviously with Dan doing a lot of shrugging and whatnot, we need to work on his upper trap through here as well. So I'm going to hit this from a few angles. We'll hit it sitting up as well. But to start with, we'll sort of pin that down towards the shoulder, and we'll get the stretch through that muscle as I lift his head up and away, like that. By taking the sort of pressure off this muscle, it'll sort of deload that compression through the spine, and again, sort of stopping those facet joints from jamming up so much. But I like to hit this in a few different ways, and we'll also get some needles into that too, see if we can get a twitch out of it. Just one more there. So next, we want to sort of work on the cervical extensors. That'll be that sort of muscle that you feel just up along the side of the spine there, comes right up to the base of the skull. And for Dan, that feels absolutely horrible, I'm assuming.
Yeah, right.
Yeah, that is right on the money. So I find the active release technique really good for this. It's not only are we sort of releasing all the trigger points and things in that muscle, but by moving the neck like this, we're also putting stretch on it at the same time, which sort of stretches out all the fascia, just changes the sort of way Dan will move after this. Now, because this has been there for a week and a half now, is it?
Yeah.
We're also going to go up a little bit higher because the way the tension from those cervical extensors will flow up into his suboccipitals at the base of the skull here. So we want to make sure these are sort of sorted as well. So we have on the sort of outside upper part of the skull here, we have the inferior and superior oblique. And the fibers of them, you know, they go sort of laterally on one way and the other way. So that's why we sort of take it back this way as well. That's not catching from that joint. It's just the pressure of me. Just horrible, yeah. This is one of those ones when it's really nasty, you can almost feel a little bit nauseous from it, right?
Yeah. I can feel it all through my head.
Yeah. So this is often, if this muscle becomes really horrible, it'll be the one that sort of creates tension headaches. So Dan, you can feel as I'm pushing on it, I'm assuming that's radiating around here. That's that classic tension headache sort of region. Good. Now, while we got you laying here, let's work on that joint. So Lily, you can stay there. We're going to do a little bit of joint manipulation, and that's to sort of really open up that facet joint. This is probably, this type of injury, it's the gold standard for chiropractic and what sort of works really well with joint manipulation. One there, take it the other way. That's the money right there. All right, can I get you sitting up now, facing that whiteboard? We're going to work a little bit more on that track. So for this one, we're going to start with Dan's arm out to the side. Dan, you're going to keep that arm straight, taking it down to that left knee. Let's go for it. Good. Got a few more of those. Good. Yep. Yep. All right, Dan, let's go face down now. And I'm thinking we'll try to get the lower joints down here sort of moving a bit more as well. Put your arms up on this armrest. Yeah. All right, so big breath in and all the way out. Beautiful. That was good. Yeah. All right, next step, I want to get some needles through these traps, up through those cervical extensors, and we're going to get right down to that facet joint to sort of decrease all the inflammation around there.
Cool. Got a couple light training later on, that'll be fine.
Totally fine. I'll just have a longer warm-up. Yeah. Sometimes I find it's actually better to train after this because you'll ingrain those movement patterns. Yeah. It'll be a little tender at first, but it'll go away as you get into it. So Lily, see if we can get a twitch out of this. There it goes. That was massive. I'll go to the other one as well. Come around. Oh, mate. Oh, beautiful. I needed it.
Yeah.
All right. These ones might be a little bit more sensitive. You're good?
Yeah.
Cool. We've got 2 more coming. All right, there we are. And pause there. All right, so they've been sitting in there for 5 minutes now. Take these out for Dan. Let's have a sort of look and retest, see how his neck's moving now. So Dan, sitting up, facing that whiteboard again. And now the big one for you was the rotation and the extension. So if you turn right all the way, good. How's that feeling now? You still getting that better?
A lot less catching now.
Yeah, good. Let's have a look up. I'm not expecting it to completely go because the joint was inflamed, but it should be reduced. So if you...
Yeah, it's a lot freer.
Yeah, it looks smoother. You didn't have that catching point now as well.
I actually feel my neck stretching now.
Yeah, good, rather than this jamming. Perfect. All right, so I think we'll leave it there. And for Dan, really, he's going to go do another CrossFit comp next week. And I'd sort of recommend one more, and this should be pretty much cleared out. So guys, if you've liked what you've seen today, give us a subscribe, and that's going to help me make more videos for you to watch and sort of see how we do sports chiropractic. See you next time.